Board of Health Zoom meeting for Wednesday, May 5th, virtual meeting. Tonight is just a COVID update with correspondence, member comments, public comments, and minute approvals, no public hearings. So we'll get right off to the start. And Jim, if you wouldn't mind.
Sure. So just a quick update on some numbers. The 2-week rolling number, which we talk about, that the state publishes, actually it'll be published tomorrow, but we kind of get a preview of it on Wednesday mornings, has Littleton at about 29, which is just one case less than it was last week, based on the numbers that I had. So it hasn't gone up according to the numbers I've seen, but we're kind of staying put. The weekly number, so I get all the reports, so I can provide the police and fire with addresses for public safety. Those numbers last week, and starts on Saturday, we go from Saturday to Friday. There were 10 cases, which is less than the previous weeks, so that's fine. This week so far, and there's 2 more days left, there's about 8 cases, so unless something goes crazy, hopefully those numbers are trending down, which hopefully bodes well for the rolling number. Statewide, the a number of active cases continues to drop, which I think is a really good thing. Although I was looking at the dashboard today, for some reason the number of tests administered was pretty low today, so maybe Katrina has some insight on that when she chats about it. With regard to vaccine numbers, 62%, according to the state's report, and this is as of April 27th, 62% of Littleton residents received 1 shot. 38% of them are fully vaccinated. And then as far as the governor goes, I mean, given that the numbers seem to be either trending down or staying reasonable, I suspect the next kind of milestone in the reopening plan, which is scheduled for Monday, will occur. And that's as I mentioned last time, the large venues get to go from 12% to 25%. Theme parks, amusement parks, water parks can go to 50% capacity. Road races, large outdoor organized amateur sport events can occur. So again, unless something, we'll probably know more on Friday at the governor's conference if there's going to be some changes that won't be allowed. But I suspect, based on the numbers, that those changes will be allowed to go forward on the 10th. I don't know if anyone has any questions.
I have a personal question. Do you think I should get my money back for my Lady Gaga tickets for September at Fenway?
Well, so by August 1st, if all goes well, we're supposed to kind of be back to normal, maybe. So I don't know. Things may go all right. And with the numbers at the large venues, we're up to what, 25% next week. So
yeah, by September, you think it'll be back to full capacity?
I think, again, they always kind of quote it by saying based on public health data and the vaccine data. So hopefully, if we keep getting vaccinated, that'll bode well for more and more things being possible.
Mm-hmm.
I have a question.
Go ahead, Gina.
Thank you. Jimmy, CVS in Littleton, CVS.com,
yep.
They do the vaccine. So if you have anybody that they live in the area, they can't drive anywhere, tell them to make a call to CVS.com and make an appointment, and then they can practically walk to Littleton's CVS.
Right, and I heard that some of the CVSs may actually, or was it Walgreens, I forget which one, but may actually start doing some limited same day or walk-in appointments.
Yeah, I heard that too.
Yep.
You have to have an appointment. In Littleton, you have to have an appointment. Just to let you know.
Yep, thank you.
Thank you for doing it.
Yep, no problem. So with any luck, we're just waiting for vaccine confirmation. We'll start a soft opening over at Devon soon. So once we get vaccine confirmation, what we'll do is we'll send out a note to all the boards of health so that you can put it on your websites. The clinic's open to the state. It'll go up on the public site, but we'll send all the boards the link. It may be a little slower getting out to the public than if you guys put it out on Facebook and the pages. So we're crossing our fingers and hoping that that's going to happen.
Is that going to be for anybody in particular or anybody that's eligible?
It'll be anyone who's eligible in the state. So we'll be getting Moderna vaccines. So it'll be 18 and above.
Great.
Yeah.
Good. Anybody else have any questions for Jim? Go ahead, Louise.
Last week I had asked the question if anyone knew how soon you could get the vaccine after having COVID. And I called my daughter's pediatrician and they said you can get the vaccine right away after you're healthy. So then I went on CVS.com and then, there's a couple of questions you have to answer. And the questions are, have you been in contact with anyone in the last 14 days that has COVID, or have you had symptoms in the last 14 days? So CVS makes you wait 2 weeks. The doctor says you can do it right away, but the questions you have to ask, it depends. I didn't try any place else to see if the questions were different, but it's kind of a built-in waiting time, I guess.
Mm-hmm.
Well, so people who have had COVID, 10 days is the minimum isolation time. But there are people who stay sicker longer. And so the idea is it's a minimum of 10 days or until symptoms resolve for 24 hours. So whether they build that in just for kind of a buffer or.
Oh, yeah. It went through our whole house, Jim. I'm sure my address was one of the addresses you were given to.
I'm sorry to hear that. I hope you're all feeling well and doing well.
My husband was in the hospital for 4 days.
That's terrible. Wow.
Yeah, my daughter Julia had pneumonia.
Yikes.
Yeah,
Wow.
they got it pretty bad, but 3 weeks we were home.
Wow.
All together.
So how come that number's not 5 down or 4 down? Just one less than
5. It would have been 5 less.
Yeah.
Crazy.
Oh, yeah.
Sadly, that means there's 4 others. Who got it this
Yeah,
week.
right. Yeah, someone took our place.
Well,
Yeah.
again, the period of time that it's recording is I believe it's the time frame is the 18th of April through the 1st of May, I think, is the reporting period. So.
Yeah, we were still. I think that was our last week.
Okay.
All right. Any other questions or comments for Jim? Kevin or Mike? No. All right. Katrina, you ready? Can you?
Sure. I'm as ready as I'll ever be. I make it up as I go anyway. So just kidding. All right. So today's data was dropped a little late, so I'm a little more to the wire than I normally am for a Board of Health meeting. All right.
We appreciate you being here. Thank you.
I'm assuming you see my slide deck today.
Mm-hmm.
Okay. All right. So we'll jump right in and try to make this short and sweet for you. So here are the 4 main metrics that we've been looking at from the beginning. We see some really positive trends. The 7-day average for cases is dropped. Test positivity is held low and flat, steady over the last few weeks. Hospitalizations they went up for a while, but they've been declining over the last couple of weeks. And the deaths have just been steady at less than 10 for the last few weeks, which is awesome. If we dig in a little deeper, Jim, I don't have the answer for you about why testing has declined. Especially, there was definitely a lag in the data reporting last week, and then I see it again this week. It was still low. So they're leading up to April break, the tests had been like steady straight up through from like January all the way through the week before April break. And then April break, we had the dip that we normally get over a vacation week, and it didn't come back up. So we were definitely at a lower level of testing than we have been for a while. However, the number of antigen tests are increasing. And so this molecular test level is decreased while the antigen test is increased. So that could just be that it's offsetting in our graphs. The state doesn't present a rate for the number of tests for the antigen tests. So we'll just keep an eye on this as we go forward. But these number of tests are much higher than they were a few months ago for the antigen tests. All right, so test positivity, like I said, it's actually been declining. In more recent days, it's been kind of holding. Last week, it was 1.7%. This week, it's 1.6%, so about the same. And when test positivity is pretty much straight flat for every age group with small bumps here and there, up and down. The decline here, this red line, is the 15 to 19-year-olds. So this was kind of nice to see. This has been declining over the last month or so. So everyone else has just kind of held steady with a couple bumps here and there. So we'll see how this goes over the next few weeks. So here are our cases. Now remember, our testing's lower. So our cases are also lower, but that doesn't mean that our data is, it's kind of in that, is it low because we're not testing, or is it low because of something, or because there's just less spread? And given the number of vaccines and things, this is probably less spread. We don't see as many people. Jim probably isn't getting as many reports as he used to, or we're getting steady number of reports for our area, as Jim just reported. So, and the areas around us seem to be going down. So this seems like this trend, slow decline, has continued over the last couple of weeks. We're now about, the 7-day rate is just under 1,000 a day. So that's as well as we were in like October of last fall. And then the state just updated this rates by age group, and by far the highest, the group with the highest rates are the 15 to 19-year-olds. And then that's that bell curve again, where we have the 10 to 14, 5 to 9, 0 to 4, and then also the 20 to 29s, 30 to 39s, and keep going down. These are more impactful, I think, when you look at those over time. So we are going back 7 weeks now, because I didn't truncate my data yet. So the highest rates, again, are the 15 to 19-year-olds. They've been the high rates over the last 3 weeks, but they're also declining. So that's a good sign. The 20 to 20-year-olds have had a steady decline for the last month. Now that they've become eligible for vaccines, that's a great sign as well. They had been the highest group for the whole time. So this is a good thing to see. And then you get those family clusters of the 0 to 14 and the 30s to 59 age groups. Our 60 to 69-year-olds continue to decline for about a month now, again, since they've become eligible for vaccines, which is awesome. And then our 80 or 70 plus, these two lines are just steadily just holding level, actually declining recently in the last couple of weeks lately. So these are nice things to see. As we get more people vaccinated, our rates are coming down, and these vaccines are known to prevent spread. So this is great to see that those groups who have been prioritized for vaccination, and everyone 16 and older can get vaccinated at this point, are seeing some movement in protection and spread. So like I hinted at the beginning tonight, that hospitalizations had, from the middle of March through the early part of April, just after Easter, our hospitalization rates were increasing, but for the last 2 weeks, we've had a steady decline. So that's nice. Now we have about 560 patients in the hospital each day. The capacity is actually improved. So there's 84% of hospital beds and 73% of ICU beds were occupied with COVID patients. So that's nice to know that we're actually getting better on our hospital metrics over time. That's great. And the 7-day average for confirmed deaths remains steady. It's been this way since the middle of April. We've about 10 deaths reported per day. So that's a nice sign. Again, death rates are as low as we've had from last summer. So while our case rates and our case rates are similar to levels we had in October when we were starting to go up, and our hospitalizations rates are similar to the middle of November, right before we hit our peak, when we started to really escalate higher and have some issues with hospital capacity and things. Our deaths, because we prioritize the older age groups who are more likely to die, our deaths are just as low as they were last summer for COVID when we were totally shut down. So this is a great sign. This is good progress. This is what we want to see. So changing up how I present the vaccination data, this is actually from the CDC data. 3.9 million, about 66% of residents aged 18 or older in Massachusetts have received at least one dose. Jim just gave it to you for everyone, including kids. The CDC, this is their adults and older age group. And then what's nice to see is not only is Massachusetts very high in the highest category, but also all of our neighbors in New England are also similarly high. So it's amazing to think that our region is really doing a great job with vaccinations, because that will just protect everyone, and we can cross borders to New Hampshire and Maine and Connecticut and Rhode Island for vacations, and Vermont, and not, we'll still have those similar rates, hopefully, in the end. So those kind of protections from vaccination.
It's like we can go to Hawaii and be safe too.
We could go to Hawaii. We've been able to go to Hawaii this whole time.
Right. Yeah. Mm-hmm.
Hawaii didn't necessarily want us. They made that hard, but we could have gone there. All right. So rolling back to the DPH data as of last Thursday's report, these are the number of cases reported in Littleton week over week. So the last Thursday's report had us at 30 cases. The 2 weeks prior to that, we had 28 cases. And in between those two dates, we had this dip of the number of cases. So this is why I compare 2 weeks back, because they're two distinct groups of people, and you can kind of see what's happening when it's two different groups of people. It's easier to compare. And so we were really just steady as of last Thursday. So again, we see funny dips in our data, in part because we had that sharp decline and a sharp rate back up. But if you think about it as that was a weird week, we were pretty much just steady and flat. Everywhere else has actually been declining for a couple of weeks now. So this is, again, the rates per 100,000, so we can compare areas. And these are all the areas that we've been tracking. So Littleton's rate was 22.0. The state was at around 20. So we were similar to the state level as of last week. And then total test positivity. So that's the number of positive tests over the number of tests conducted. And these are PCR tests, not antigen tests. Our test positivity last week was about 2.4%. And that was, again, similar to the 2 weeks prior to that. And we had a stable number of tests. We keep having that 1,200, 1,300 tests. So we were in the same range of the number of tests last week. So when Jim gave us the report today, Littleton had 29 cases. So last week 30, this week 29, which when you look back 2 weeks, it's higher than 2 weeks ago. So again, I suspect there is something up with vacation week and reporting lags and things. And I'm willing to look at this and just say that we've been steady for the last 5 weeks or so. But again, we're in the red. So we don't have that many cases. Our color coding is based off case definition alone, just because of the size of our town. So we are steady right around the 30 person mark and have been that way for 5 weeks now. So hopefully over the next few weeks, we can start trending lower again. And the reason I would love for us to trend lower again is because our vaccination rates are outpacing the state's average for vaccination rates. So this data comes from the weekly vaccination report, where they do it by municipality. So this is from last Thursday. 62% of Littleton residents as of last week had received at least one dose, of which 38% were fully vaccinated, which is excellent. And the proportion of people who received at least one dose for each age group was also high. So for 20 to 29-year-olds, we don't actually have that many 20 to 29-year-olds in our town, but 67% of them had at least one dose. So they'll hopefully follow up with their second. 30 to 64-year-olds, that parent age group, if you will, to retirement age, 77% of people had at least one dose, and 65 plus, we had 85% with at least one dose. And there was something like 200 people in the 65 plus group who had not yet accessed vaccines. And hopefully, Jim's clinic, vaccine clinic opening up, the CVS in town starting to have appointments, and other CVSs in the area where we can even just walk in. Hopefully people will start being able to get one in their local area without much trouble. So that would be great. And then again, females are outpacing males, 66% to 58%. And I'm not, the men's coverage is very high compared to many states in the US, but I would love to see these balance out, because we do have similar numbers of males and females in town. So to have the same proportion would be great. And the other thing to keep in mind is that males have a higher risk of severe COVID outcomes, hospitalization, and death, just like we just heard one anecdote. So these vaccines are almost more important for men. They're important for everyone, let's be honest. But given males have a higher risk of severe outcomes, it would be great if we could just make sure we're reaching everyone and having the discussions in case there's reasons why they're hesitant or just not making an appointment. And then the 0 to 19-year-olds, clearly that's not a fair age bracket to group everyone in, given that vaccines are only eligible to 16 plus, but there were a couple hundred individuals in this age group who were at least one, had received at least one dose. And I have to say, like, seeing the high schoolers keep going to get vaccinated has been really, I love it, given that their age group is in the highest, has the highest rate. So it's nice to see that locally we're getting some kids vaccinated. So as they celebrate senior year, end of year stuff, that will hopefully protect them. So just running through our reminder to continue to use mitigation. So I presented the data on the variants last week, and I don't have updated data. So the variants are here. Multiple different variants are in our state and circulating. So they're more transmissible. And if you kind of drop your guard, or you're not especially if you're not vaccinated, then you have a higher likelihood of getting sick if you are actually exposed. So, and our webs of connections continue to expand. We have spring sports happening. We have people going back to the office. We have people how restaurants are starting to expand. And I love that these things are happening, given that our state has high vaccination levels. So we should be rewarded with being more relaxing our restrictions, because we are a highly vaccinated state. So, but just especially if you are one of the unvaccinated people, just continue to take caution where you can. So the big thing is we can do slow the spread by doing 2 of 3 things most of the time that we're out and about. So either keeping your distance, wearing your mask, and or being outdoors. So outdoors is one of the safest settings you can be in, because any virus that if someone is sick, that gets expelled into the air disperses quickly. It dilutes very quickly, especially with wind and sun. It will go away much quicker versus an indoor environment. And if you are unable to be distanced in that outdoor setting, you should still wear your masking then. So just keep the 2 out of 3. So can you keep your distance? Great. And you're outdoors? Awesome. So you can take off your mask in that setting and then switch it up. So if you're indoors, you need to be wearing your mask and try to maintain your distance as best as possible. So all those things add up. This is just simplifying the CDC's masking guidelines and our state's masking guidelines and everything like that. Just keep your mask with you, throw it on if you get into dense situations. If you are fully vaccinated, you have a little bit more flexibility with these things too. So highly encouraged. That's the benefit of vaccination, is that you can start to relax some of these things. And masks are still going to be required in crowded outdoor settings, just like I just said, where distancing is not possible. So just make sure you keep your mask with you, just so that if you're in a certain setting where they ask you to put your mask on, you can. So the other thing, while masks and outdoors and testings help prevent spread, vaccines are our way out of this pandemic. We've talked about this for weeks now. So this is the Massachusetts data, but I grouped it 70, this is the case rates. I grouped it for 70 people 70 plus, and then 0 to 69, just to show the impact of vaccines for these age groups as we went through the spring. So you can recall that people age 75 plus, and then people age 65 plus became eligible in February when supply was a little bit lower. So that was that longer period where these people who are older or had 2 plus medical conditions could seek vaccines, but everyone else was unable to yet. So you can see for the whole pandemic, the lines for these 2 groups were actually parallel throughout the whole thing. It was like a roller coaster rails riding together. They were parallel the whole time until the start of vaccination occurred. And then a few weeks after vaccination started, right around February break, we started to see the case rate for people 0 to 69 slowed to a stop. And then a few weeks later, started to go back up. However, for people 70 plus who were among the group who are eligible to be vaccinated and were getting vaccinated at a pretty good rate at this point, their rates continue to decline and have continued to decline all spring. So the difference between these two lines is actually the effect of the vaccine. And so what we're seeing in the more recent weeks as the younger age groups start to decline is that their vaccine effects are kicking in, and we're starting to see that decline. So hopefully the goal is to get this black line to meet this purple line in the end by getting as many people as possible vaccinated. And I know that means that people 0 to 15 are not currently eligible, but this kind of trend has been seen worldwide. So it's not only here in Mass, but it's in the US and Canada, Europe, Israel. These things, the more you get vaccinated, the more the rates go down, including for groups who are not eligible to be vaccinated. So the more people who get vaccinated, the more we protect everyone in our communities, not just those who are able to get vaccinated. So I'm encouraging, I keep pushing it. I'm going to be a broken record for a few weeks as I encourage people to go get vaccinated. So the other thing that's now that supply isn't the constraining factor, and people who are ready to get the vaccine have gone and got the vaccine or have appointments at this point, we're running into more like misinformation, more the hesitancy, the reasons why people may want to hold off on getting vaccinated are starting to show more, because we're kind of out of the early adopters are out and done, and now everyone else is kind of you now know who everyone else is. And so the messages for the misinformation campaign are hot and heavy right now. So I just keep repeating that these vaccines are safe and they're effective. The clinical trials for all 3 of the vaccines were among the largest in histories for vaccines. So that is really encouraging to me. There's a lot of safety data on these vaccines as well, because millions of people in the world have received them at this point. And they're being tracked closely by the FDA, the CDC, the European Union, equivalent to the FDA. They're highly scrutinized because, and it's important that they're highly scrutinized, because if there's something happens with these vaccines, they're actually going to impact all vaccines. So this is one of those reasons that these have been highly studied, highly scrutinized. People are on top of this because it's really important, not only for COVID, but for everything. So I've heard rumors that people are saying that these vaccines have been linked to infertility and miscarriage, and those studies have been looked at, and there's no link there. There's no increased risk of those things. There's no increase of the risk of autism. That was like 20 years ago, disproven. So, but that rumor is still around. So those things are not an issue. So basically, if you hear something in the news and you're questioning it and it makes you hesitant, I really highly suggest you reach out to your doctor to have that conversation of like, hey, I heard this and I don't want to get vaccinated until I have a conversation about it. And this is, have that conversation, because that's, they're the best source of information, not only about your own health, but of these vaccines too, and which one would be the best one for you. So please talk to your doctor if you have any questions about this. And then I'm just going to keep repeating, this is the most effective thing we can do to get ourselves back to normal, to hit that benchmark in August where we can lift all reopening restrictions for our businesses and start things much more open and being able to get back to normal. So there we go. That's this week.
Great, thank you. Does anybody have any questions for Katrina? Great. Can we use that slide, the one about the trust the vaccine?
Sure. I don't remember which public health group put that one out, but yes, you may. I'll send it to Janet.
And Dave, put that on.
Oh, and Dave. I don't know if I have Dave's email, but I'll send it to Janet and she'll send it.
Great, thank you.
You're welcome.
Any other questions, guys? Go ahead. Gino, you have a question?
Well, I am mute because somebody shut me down. Nevertheless, I wanted to say to say to Katrina, you're doing a good job, and thank you so much for the information you're giving us.
Thank you, Gina.
Now you can shut me off if you want to. They don't like me no more, Katrina.
All right.
I like
Moving-
to see a smile, though.
Everybody ready to move on? So we'll move on to member comments. Thank you, Katrina. Thank you, Jim. Actually, no correspondence. Does anybody have any correspondence that they need to share tonight? Nope.
Thank you. No.
Jim, maybe you can answer this. I got a request from the reporter from the Sun who asked about the Life Care Center being in compliance, and the last report I had said that everything is fine. Did you see or hear anything about that?
One of the reports that's up on the state website is what they call a public health weekly report, and includes information on long-term care facilities. And one of the columns on that talks about staff testing compliance. And I think when I looked at the report, that's where the non-compliant component was.
I thought it was I thought it was their wastewater.
No, so one of the things that happened back, I think it was back in either May or June of last year, right in kind of the heat of all of this the state came out with some financial incentives to have, to help nursing homes with staffing and testing. And one of the requirements that was that you test your staff at a certain frequency. On that public health report, it talks about the testing frequency that you need to maintain. And it's every other week if you have fully vaccinated staff, and weekly for unvaccinated staff. And again, the reporting period was from April 1st to the 15th, or I think the 15th. And that's where according to the chart, that's where the non-compliance was. I think in that same report, I think probably an important number is in the past 14 days, there were no new cases at the nursing home. So whatever's happening there seems to be working. The nursing home is licensed by the Department of Public Health, and that is their report. So that reporting is done. It's a self-reporting process to the Department of Public Health. And again, in the beginning of the report, when it talks about what all the columns mean, it talks about the potential for some financial ramifications if they don't meet compliance with that.
Okay. Is that anything that we don't deal with?
No, that would be up to the Department of Public Health to address.
All right. Okay, great. That was all I had. Anybody else have anything that? Okay. So moving on to member comments. Does anybody have any comments at all? Kevin, Mike, no? Louise, no? Gino, you good? All right, and on to public comments. I think Kevin Davis is, I don't know if he has anything else to talk about, or I just saw him earlier, so.
He's here, but there's no hand raised.
Okay, so no public comments?
Not at this time.
All right. We have some minutes from April 28th to approve. And Janet, I think I told you, okay. So other than Gino being in attendance, that was the only change that I had. So did everybody get a chance to look at the minutes? And I get a motion to approve them? Gino, you weren't there, so you can't approve them.
I'll make a motion to approve the minutes dated April 28th.
I'll second the motion.
Okay, so we'll do a roll call. Kevin Baker,
Yes.
Louise Nichols,
Louise Nichols, yes.
Mike Zeldin,
Mike Sullivan, yes.
and Lisa Flanagan, yes. All right, so they're approved. And before we move on, schedule the next meeting for next Wednesday, 7 o'clock, unless there's anything anything changes. All right. And anybody want to make a motion to adjourn?
I'll make a motion to adjourn.
Thanks, Mike. And I need a second.
I'll second.
Roll call, Kevin Baker,
Kevin Baker, yes.
Gino Fratelloni,
Okay, Gino Faralloni, yes.
Louise Nichols,
Louise Nichols, yes.
Mike Zeldin,
Mike Zeldin, yes.
and Lisa Flanagan,